what I have chosen is to speak on yoga. Yoga has gotten very popular because of the formal acknowledgement by the UN, the the International Day of Yoga, to be celebrated on the 21st June every year. Thousands of people gather to do the yoga practices, and one of the very yoga exponents keeps telling me it is on that day the sun gets salutations wherever he goes, because every day, every place, they do it in the morning on that day. Truly, hundreds and thousands. However, yoga has been with us for several millennia, and those of us who are working in the mental health field have been researching on yoga for a long time. Neuroscientists have looked at the effects of yoga, and so what I will be speaking about today is the neurobiological evidences for yoga as a therapeutic intervention in some of the psychiatric disorders. Although there are several psychiatric disorders that have been yoga has been used, today's presentation, to demonstrate the neurobiological basis, I have chosen depression and schizophrenia. Depending on the time, maybe I will stop at depression, or if we all have time, I will go on to the schizophrenia as well. 55 slides keep reminding you how far you have to tolerate me. You can stop whenever you intend to get me completed. The question that we have been asking is, yoga works in several psychiatric disorders, but it is not enough that we accept that yoga works to remove those symptoms. What we intend to look for is, would it also correct the pathobiological processes that have been implicated in those diseases? So with this question, we have been researching for the last couple of decades at NIMHANS. There is a big team of yoga researchers. There are several other things that we have done, but for the purposes of today's presentation, I will be sharing the yoga effects in depression and in schizophrenia. Why did I choose depression? Because one of the commonest conditions, most ubiquitous, it occurs in all ages, although more often in women than in men, but it is a condition which has now been considered as one of the highest contributors to disease-induced burden. It stands at position 3, and it could well reach position 2 by 2030. So everyone is preoccupied with depression. As you can see, several celebrities have been talking about that they have been depressed, they fought against it, and they are depression survivors, and so on and so forth. So depression is a condition in which yoga has been fairly extensively researched, following its research of treating anxiety disorders. So I have taken depression for presentation here. Suffice to say that depression has been effectively treated with yoga alone, and it has compared well with antidepressant drugs, although not given in the full dose but in the modest doses. But yoga was not as good as, for example, what we call as electroconvulsive therapy, which is by far the most potent antidepressant treatment. But depression people given yoga alone also lose quite a bit of depression scores. They get better. This has been published quite a while ago, and there are a couple of people who have also been able to replicate that yoga as a standalone treatment, what they call as monotherapy, has also proved antidepressant effects as good as whatever else they gave to these patients. Let me admit, to conduct what we call as double-blind trials, which is the gold standard in antidepressant drug treatment, we cannot do this standard research in yoga therapy. You can never blind a person from getting yoga or not getting yoga. Today, yoga is well known. So this limitation is there, but people have been continuing naturalistic studies. This is one of the naturalistic studies. People who came to the clinic were offered yoga. Some received yoga. Some received medicines alone, and some received both. You may wonder why people with yoga alone had the lowest scores. It's possible that people who received the best treatment or best outcome with the drug alone might not have come back at all for follow-up. So it is only those who are coming to the hospital who are still symptomatic might have been here. There are some limitations of interpreting these naturalistic studies, but suffice to say, with yoga treatment alone, substantial reduction in the depression score that happened in these people. We have published this. There are, of course, what we call as meta-analysis people have done, looking at yoga compared to usual care with antidepressant drugs, psychotherapies, etc., etc. Yoga compared to relaxation therapies that people offer, yoga compared to aerobic exercise. In all these comparisons, yoga figures out that it is better than the comparator. This is a overall meta-analysis data. So giving a place for yoga as a treatment in depressive disorders. So many centers where yoga therapy is available offer yoga as the first option to people with depression, providing that they are not very retarded, they are not very agitated, there is no suicide risk, or there are no serious side effects of the medicines that will interfere with yoga practice. Yoga is being offered in our institute. We offer them yoga. There are several people who want yoga as the first treatment. They come and ask for us, and some accept yoga as a treatment, but they will put some conditions on us. We won't be able to come every day. We won't be able to devote 1 full hour every day. Can you come and teach us yoga at home? Some of the conditions which we have not been able to accept or be able to follow. Some of them again choose drug and then they come back a little later, or if they get better with the drug, they go away. But nonetheless, yoga has a place in the treatment of depression. Now, let me come to the pathobiology which yoga is expected to change. I'm not illustrating all biological abnormalities in depression. I've taken a few of them for which we have been able to find a corroborative evidence. This is here. There are some centers in the brain. There are emotional centers. For example, amygdala, which becomes hyperactive. When it becomes hyperactive, there are some other areas in the brain which becomes hypoactive. So it is known that in depression, the frontal areas are less active, whereas the deeper structures are more active. So is the case also in some situations in anxiety as well. So this has been a reasonably, replicated data that in depressive individuals, those emotional limbic centers are hyperactive, and the external cortical areas, some of the areas are hypoactive. So this is one observation. The second observation is people with the depression have decreased levels of Gaba or decreased activity of Gaba. Gaba is an inhibitory hormone, inhibitory neurotransmitter, and this inhibitory neurotransmitter is acting less, or it is being produced less. In fact, whether it's men or women, depressed subjects have lower values of GABA. This is measured, today we can measure this using what we call as the magnetic resonance spectroscopy. In vivo, you can measure the chemical in the brain. People have been able to demonstrate this, and this is, at least 2 laboratories have confirmed this observation. Depression itself is caused by stress, or depression is a phenomenon of stress. In stress, our cortisol levels increase. In depression individuals, the fluctuations of cortisol, like healthy individuals, will be there, but almost always their levels of cortisol are higher at any given point of time than in healthy subjects. So cortisol elevation is a fairly consistent replicated data which people have found if depression is there. And cortisol has other cascading effects on the brain and other functions, etc., etc. I am not going to that part of it now. Brain derived neurotropic factor, which is a product that is required for us to make sure that our brain is continuously repaired and not allowed to go have the wear and tear part of it. So this brain derived neurotropic factor is required, and its levels are lower in patients with depression. So if you take a difference between patients and healthy subjects, the differences are positive. That means patients have a lower value than in healthy subjects. You treat them after treatment, also they get lower than what it is, not totally becoming normal, but nonetheless they tend to become like normals. Recovered people, pre versus post treatment versus controls, post treatment with healthy subjects, post treatment versus pre treatment. Again, the differences drop. So, meaning that treatment actually gets them better. Depressed patients have lower values of brain derived neurotropic factors. There are some other studies which have been done in experimental animals and in other individuals. Cortisol elevation leads to fall of brain derived neurotropic factor. So, more cortisol, more stress, our brain repair mechanism falls. So, as a consequence, what happens in depression, the repair mechanism fails, cortical areas, gray matter actually starts shrinking. And this is a data which has been shown. The red areas are the places where the shrinking has happened. So, cortical shrinking in depressed individuals could be related to the lower levels of brain derived neurotropic factor. So, there is a very interesting Sanskrit saying, Chita dahati nirjeevam, chinta dahati jeevanam. You are worried, you are tense, you are preoccupied, you are depressed, you could actually be burning when you are alive. That is the message of the Sanskrit saying. So we believe that some of the places like orbitofrontal cortex, anterior and posterior cingulate cortex, they will all start shrinking, losing the gray matter in these places. So in effect, there is a cycle of events that happen. You have the increased amygdala activity, excitation, decreased levels of Gaba because of that, increased levels of cortisol, decreased levels of the brain derived neurotropic factor, cortical thinning, and overall decreased frontal activity. So this cycle is a vicious cycle. It goes on, the depression continues and continues, and the brain shrinks and it goes on. So people say this is one of the models that people have projected for the pathobiology of depression. So what does yoga do?
Sir, can I ask something? Yeah. Thank you. I was just wondering, I mean, like typically, when there is when you said decreased GABA level, is it the whole brain lysate GABA level that you're talking about, or localized GABA level that you're talking about?
Whatever the MRS findings, they measured it in thalamus, but we're not able to measure it in all the places. Although experiments are required to have a multi-voxel measurements,
Right.
we haven't been able to.
Okay, because because typically when there is reduced GABA, you would expect hyperexcitability all over the brain,
Right.
and that would lead to probably
Seizures.
epilepsy. Correct. So
You're right.
yeah.
The equation may not be as simple as that, but it's true that some of
Yeah.
the individuals of depression have seizure potential if they are younger. But most depression studies have been done in elderly people.
Yeah.
For elder people, seizure potential actually is lower than this.
Low. Yeah.
Thank you, sir. So these are the things that yoga will produce. It will deactivate limbic structures. I'll give you some examples for each of these things. It increases the GABA functioning. At least some measures of GABA can be looked at when you do yoga. Decreased cortisol will happen following yoga. Increase in level of BDNF, and also perhaps, although it's called increased brain volume, I believe it is more likely it will prevent deterioration, prevent decay. This is a more, what should I say, conservative way of wording it rather than increase the brain volume, although I have the statistics say so. Okay, I'll give some examples of each of these things related to yoga, some of the experiments that we have done and others have done, and so on. This is a functional MRI picture of the brain, and the same produced by some other image processing statistics. Don't ask me how it is done. Connectivity, where it is connected more, where it is connected less. My knowledge how to interpret this is not as good, but suffice to say, these yellow spots are the places where following yoga practice it is deactivated. In this only we have looked at one practice, Om chanting. All yoga practices will have one session of about 3 to 5 minutes, some places even more. They chant Om either at the beginning or at the end. Different styles of chanting Om is a part of a yoga module which most often people use. When Om is chanted, this is a fMRI study which showed, these are all pictures, all the four are Om versus non-Om hissing expiratory effort. So in these two situations we found that Om actually caused deactivation of some of the limbic structures which include amygdala, parahippocampus, gyrus. So what would otherwise have been excited during a depressive state, yoga, or at least one component of yoga, I am not saying the entire component of yoga, what we could test was only this. fMRI indicated that there was a deactivation. Gaba. We said Gaba is lower in depression. Can Gaba activity be measured, and it is shown to actually increase? We have used what is called as the cortical silent period. Cortical silent period is, although it's a little misleading word, I keep my fist tense, I measure the EMG here, and as I am measuring the EMG, I give a stimulus which will, to the brain, which will actually stimulate these muscles through the circuit. So the brain motor area is stimulated by transcranial magnetic pulse. When you give the transcranial magnetic pulse, yes, of course, the EMG goes briskly up. You have been holding it tight, there will still be a twitch in that arm, in that small muscle. And that reaches a flat line, then resumes. We are continuing to hold the fist. So this length of the flat line, actually the EMG flat line, but we call it as a cortical silent period, cortical induced silent period of the EMG. And this length is expected to have a relationship with the GABA B activity. And how lengthier it is means the longer, the better was the GABA B tone. And here it is, we have a subject who did before yoga and after yoga, we measured this. This length actually got doubled. This is a healthy subject. So from this, of course, this is a larger data is there. In a group-to-group analysis, we have found that people who do yoga for a period of about 15 days have a lengthening of the cortical silent period, indicating indirectly that the GABA activity increased in these individuals. And so we did this experiment in depressed individuals. Depressed patients had the lowest level compared to healthy subjects. Depressed patients had a shorter cortical silent period than healthy subjects. Depressed patients were randomized into walking group or yoga group. Walking for about 5 days, yoga of about equivalent potency for about 5 days. So it was totally a 1 week experiment. In 1 week we didn't expect great changes in their depression scores, although they did get better. But what happened was the GABA tone went on to increase towards the direction of getting into a normal. This is a 1 week experiment. Although we have published it, we still feel that we should have done it for a longer period. People said that we are getting better, we have learned enough. That is the practice that we do. We teach them for about 3-4 days and they said we are going to continue practicing at home. Then they stopped coming for a daily session. So the moment we completed that 1 week prescription of yoga practice, we had to do this, complete the experiment. But nonetheless, this and this were different. Or in the group of people who practiced yoga, pre and post yoga, this difference was there. So prompted by this, we also looked at the correlation between their improvement scores and the Gaba tone increase. They were weakly but positively correlated, and so we think that these two are related, but we are continuing the experiment. This is another experiment where yoga practice in depressed people increase the Gaba signal pre to post. This is the MRS study done by some other agency. We don't have the Gaba measuring coil, although we have a very good MRS system. That's a separate protocol that we have to develop, and unfortunately Gaba does not interest most clinicians except for the research purposes, so people haven't really applied their mind. Cortisol, there have been any number of studies in healthy subjects. Yoga brings down the cortisol level, but we had an opportunity to examine people who are receiving yoga or medicines who were willing to consent for this study. If you see yoga people, more number of people who received yoga, almost 2/3 of them lost cortisol. Their cortisol levels fell. But medicine alone, fewer of them fell. But again, I don't want you to see this as a comparative study, because this was not a randomized design, as a naturalistic study, just as much as the depression scores. But suffice to say, 65% of people who received yoga with or without medicines had a reduction in cortisol levels in our study. This is fairly well replicated in other researchers in healthy subjects, and the group statistics also show there is about 15 to 30% reduction of cortisol levels happened in these people. BDNF, brain derived neurotropic factor, was lower in depressives compared to healthy subjects. So in all the people whom we were able to get them to repeat the blood level with the medicines, with yoga, with both of them, etc., etc., in the total group there was a significant elevation, inching towards the healthy subjects' values. In yoga alone also, this finding was fairly robust and convincing. BDNF levels elevated following yoga, and these people also obtained substantial levels of antidepressant effect. This part is interesting. In people where the cortisol levels fell, and in whom we were able to get also the BDNF level changes, in the group where the cortisol levels decreased, the BDNF levels rose, and vice versa. It's possible to believe that cortisol, although it is not good enough to indicate a cause and effect relationship, but it suffices to believe that cortisol levels lowering caused the brain repair mechanism better than what it could otherwise have been. This is the last slide about depression story. We had elderly subjects who were not depressed, who had subjective memory complaints. They were not dementia. They were all offered yoga practice in the elderly homes they were staying. Our colleagues went and taught them yoga. This was there was no random allocation. There was no group which did not do yoga, etc., etc. And we had not many people who were willing to come from that elderly home, which was 30 kilometers away, come and get an MRI done before yoga and after 6 months of practice of yoga. Luckily, we were able to get consent of about 7 people who were willing to do this before and at the end of 6 months of practice of yoga. We measured the gray matter by the voxel based morphometry. Please remember, it's a statistics. In that, we wanted to see what is the change in the gray matter of the hippocampus. And why did we choose hippocampus? With aging, that is the first part which starts shrinking. In my brain, the hippocampus would have shrunk between the time when I was 40s and now, or between the time between I became the director 3 years ago and now. It's also possible between the 3 months ago before the election results came in April and now also it would have shrunk. So as the age, this starts shrinking faster and faster. It's possible by the time I get out of the hall at the end of the lecture, 1 or 2 hippocampal cells would have died. It's possible. But luckily there are so many other parts of the brain which compensate for me. But mind you, with aging, all of us lose hippocampus, all of us lose gray matter. It is a age appropriate phenomenon that will happen. And the first part that starts shrinking is the hippocampus. Average age of this group was 72 years. 7 people. So what we were saying, what we were hoping to happen with yoga practice was this shrinking will not be picked up. But my colleague who is in the image processing person, he tells me, sir, actually it increased. The voxel based morphometry before and after yoga says those yellow spots which he identified, these are the hippocampal areas where the gray matter actually increased. Why did it increase? More arborization, more branching, etc., etc. There could be 100 reasons. We have not been able to replicate this study to get a randomized group at healthy people doing yoga, getting them to the MRI, doing it twice, elderly subjects. Be assured that there will be 100 human rights activists who want to chop my head off. We're not able to do it. We, of course, it's an interesting sub area. We are pursuing it, but it has been a challenging task getting people to come over for this purpose. So, there is another way of looking at the whole story. People who have been long-term practitioners of yoga. This is not by our group, by somebody else who has published this. And of course, there are many people who wouldn't have practiced yoga. So, in all of us, this phenomenon happens. With age, we all start losing gray matter. Normal. Normally it happens. All of us lose gray matter. But those who did practice yoga were abnormal. And then they preserved the brain. Gray matter was preserved. So, or supernormal, whichever may you want to call it. So, this fall was prevented by practice of yoga. So, the same phenomenon of chinta dahati nirjeevam, chita dahati nirjeevam, chinta dahati jeevam. This phenomenon happens. So, with that, are there any behavioral effects? Are you able to prevent the brain neuronal loss or activating the brain neuronal activity? Can you pick it up? Yoga treated depressive patients obtained increases in the levels of the P300 event related potential. It is also called as one of the cognitive potentials. The cognitive potential amplitude got better compared to when they were ill. It was lower than the healthy subjects. So all these exercise, all these effects may translate behaviorally also, not only in terms of they getting better in terms of depression, but also one of the physiological measures of cognition also gets better. So the cycle yoga affects at each point in this cycle. So this is about the story on depression. If you all fine, I'll go through schizophrenia. I want to know whether I need to continue.
So, sir, before you go through
Sir.
this schizophrenia, you remember you came as an examiner, my student at AIMS.
Adolescent depression.
Adolescent. So,
Cortisol, the same story.
sir, you were the examiner. We measured the 4 neurotropic factors: VTNF, LT4, Neurotropic, and one more. All were different.
All by perfect.
All were different. Sir, another thing. I'm in laboratory. I'm not in neurology. So you were talking of the cognitive potential. we measure the lymphocyte potential, membrane potential by flow cytometry. That paper is not yet to be published, and we got some definite changes.
Sir, only one question. What does SKY stands for? What does the SKY? SKY stands for in your previous slide.
Where, madam?
Previous slide. Yeah, this one.
This one?
Yeah.
Sky means Sudarshana Kriya Yoga. It is one of the form of yoga practice. I think. In this, they did that. In this, they did that.
Excuse me, sir. Okay, if you may answer first. Is it answered? Actually, my question is that do you have ever used a disabled person as your sample in yoga? Any impaired?
For example,
For example, hearing impairment or visual impairment.
we have not looked at that, madam.
And interaction.
There could be some people who are doing, could well have been having hearing impairment. We did not look at whether that impairment got better. We have not studied.
No, I'm asking that in my study, I found that the people having hearing impairment, the congenital hearing impairment, have a greater amount of or negative thoughts in them. So maybe you.
I will keep this in mind. We have not really applied our mind on that.
Okay, thank you.
Excuse me, sir.
Yeah.
So,
Yes, ma'am.
yes, I wanted to see that slide where you are showing P300.
Any doubt?
There were some changes, and I don't know which week it would be, but there are some changes which are depicted. The first.
No, this is
negative
the
P.
potential
This is the P300.
in the healthy subjects.
Yes.
This is the amplitude of the P300 potential, which is usually about 10 microvolts. In the depression, it will drop to about 5 or 6. These are the two different types of depression that we have examined. Don't worry about the names.
Okay.
After treatment, the values reach to become normal. The amplitude rose to almost 11, whereas the healthy subjects, of course, this is the same healthy subjects group which had a values of about 12.6. Okay, I'll quickly run through some of our observations in schizophrenia because this is, yes, madam.
Sir, in all these slides, what kind of yoga are we talking about? Is the whole set of yogasanas
Yeah.
or the specific yoga?
Okay, that question is common to schizophrenia also, you can come back.
If you're already going to cover that.
Yeah, that part of it. Yes, sir.
Sir, I have a very specific question. So, as Gangadhar slide mentioned, in depression, the frontal activity has decreased. So, in some of the previous studies by Shadia Tellis, like on the hemodynamic responses in Kapalabhati, they have found no significant hemodynamic activation during Kapalabhati. So, do you think the frequency of the breath in Kapalabhati has some effect on the hemodynamic activations?
Yeah, we have, let me admit, I have not done so much of work on Kapalabhati. I published only one paper on Kapalabhati. Kapalabhati in patients with schizophrenia, unlike in these people. Schizophrenia people also have a hypofrontality. Kapalabhati increases the frontal activity, but not as much as in healthy subjects. We have been able to do that, but I am not in a good position to give corollary of Kapalabhati, various frequencies and a relationship to depression. I will have some limited knowledge. Yoga, the meaning of yoga is samyoga yoga ityukto jivatma paramatmanaha. It is a method of blending my personal consciousness to the cosmic consciousness. So it unites. Yoga comes from a word called yuj, to unite. What does it unite? My personal consciousness to the cosmic consciousness. The whole exercise of yoga is to bring together. It brought all of us together for this evening. Yoga lecture, whatever may be the way. Yoga brings things together. And spiritual people talk about consciousness. A lot of doctors will say it brings together the mind and body. They say it brings together the autonomous nervous system and the regular nervous system. It brings together the thought and affect it brings together action and the feelings. So many interpretations have been made. So the bringing together being the story behind the yoga's success, we wanted to see whether this will translate into any therapeutic value in some of my patients. Why did I choose schizophrenia? Schizophrenia itself is schism, break, divided. Divided various reasons. It divides or separates my thought and my feelings. It separates my actions and my thought. Separates me from my family. Separates me from my classmates, colleagues. Separates me from my profession. So I become more of me than we. So whether that me can be translated to we with yoga is a intuitive question, is possible. So we went on to examine yoga in people with schizophrenia. Schizophrenia people have some positive symptoms and they also have negative symptoms. Positive symptoms are those which are quite violent and talking irrelevantly and so on and so forth. You treat them with medicines, they all get better. Substantial amount of positive symptoms. Negative symptoms which actually contribute to that schism, they are different. This is the area where drug treatment has not been always very encouraged. So positive and negative symptoms. We also have cognitive symptoms. In this cognitive symptoms, there is a neurocognition. Their ability to be as intelligent as other people has become less. But more importantly, social cognition. Ability to empathize, ability to understand others' feelings, ability to communicate to other people with their affective responses. These are all limited. Ability to abstract has been limited. So this social cognition impairment actually reflects quite a bit on their social functioning as well. So social cognition deficits and negative symptoms almost go hand in hand. Both have posed serious challenge in treatment and people are researching into various drug treatments for that. Schizophrenia has also been described by people as a connectopathy. The brain, earlier we were taught that there are some centers. Earlier also I talked about depression. There's an emotional center, there's etc. etc. People are talking of centers like you saw the other picture there. Connectivity has become very important in our understanding of the brain function. So networks and connectivity. So amongst one of the connections is the corpus callosum, which connects in schizophrenia. We know that the corpus callosum is thinner or has less white fibers than otherwise. Schizophrenia people also have poor connectivity between frontal and the occipital. They also have a poor default mode network. I'll come back to that when I'm showing some more slides. So connectopathy has also been a name that people have used for schizophrenia. So we thought this samyoga yoga ityukto jivatma paramatmana. This yoga which connects my consciousness with the cosmic consciousness, in that process should start connecting to neighboring consciousness. It should start connecting to people so that me should become we. And with that hope, we went on to put yoga as an intervention in schizophrenia and also look at the pathobiology of. You want to take a photo, man? This one? Yeah, go ahead. So in the process, we went on to look at various neurobiological processes of this connectedness which yoga should produce, and that is lost in schizophrenia. Schizophrenia people are not connected to the society, connected within themselves, and so we went on to look at how this connectedness can be examined in schizophrenia. To begin with, we started whether actually these people get better. These are the people who have schizophrenia, getting anti-schizophrenia, antipsychotic drugs. The acute positive symptoms have all come down. The negative symptoms and the social cognition deficits have continued. But that's something that we really not have applied any of our mind. We don't know what other medicines are available. We went on to give them antipsychotic medicines. They come week to week, fortnight to fortnight, once in 3 months, once in 2 months. They take their medicines and then go on and on and on. There some people have to be on treatment for years, some for several years. These are the people whom we thought we should examine if yoga actually produces benefits in them. These are the outpatient schizophrenia people in whom the medicines have remained stable for more than 3 months, and they also are quite dysfunctional. Family says that they are not they are not the same person, and so we put them into treatment. This was a randomized controlled study where we had people with yoga, with exercise, or with wait list. They waited until the end of 3 months before being allotted to yoga if they wanted, or exercise if they wanted, or leave the study. Sadly, we had about 30% dropout in most of the groups, but at the end of the treatment, the number of people who actually obtained benefit, in negative symptoms, the yoga produced the highest number. About a third of them actually obtained improvement, whereas a very few, maybe less than 10% of them obtained improvement in negative symptoms if they were given exercise or wait listed, both compared similarly. Overall ratings also was better in people with schizophrenia, and in schizophrenia people, social functioning also got better. Although I am not showing this slide, this data was published. Both these papers have been published. Now,
sorry, I couldn't see from here, but was it PANAS that the scale which you had used?
PANS, yeah.
PANS.
Positive and negative syndrome scale. This you can measure only the positive scores, wherein all groups behaved more or less similarly. Anyway, they had a lower score. Of course, this is not the score, this is the number of people who got better, about 25, 30%, 20% of them. But 30% of them obtained improvement in negative syndrome scores.
And these three must be different control groups, I mean, experimental and control groups?
No, this group which received yoga, group which received exercise, group which received nothing at all, they waited for 3 months. 3 months of study.
Thank you.
We also measured their social cognition. There are social cognition tests in psychological practice. We have devised the social cognition tests, and the social cognition composite score went on to become more over the course of yoga therapy in schizophrenia people. But in those people who were waitlisted, the change was, this is a different study. The earlier one was different. This is a different group in which we have studied. But again, all outpatient schizophrenia subjects, wherein yoga produced significant benefits if in schizophrenia people with respect to social cognition score. One of the typical tests amongst the composite scores, one of the typical tests is we show phases of various emotions, whether these people identify that emotions correctly. In our earlier study, we found the accuracy of identifying the emotion on the faces presented got better if yoga was given in schizophrenia individuals over the course of time. Their accuracy improved. Then, of course, some more tests have been added by our psychology and neuropsychology colleagues in our institute. They call it a theory of mind test and so on and so forth. My knowledge is very limited. I only believe in this composite score. It got better or not? It got better.
And so the patients were also similar? I'm sorry.
Yeah, both groups were comparable.
The patients of schizophrenia were also like similar in acuteness of the disease.
That's what I'm saying. This is the randomized group. Once they are randomized, it is believed that the issues are taken care of. When I am talking of social cognition, I want you to remember, I just want to demonstrate it with an anecdote, what change it produces in actual life. This is a lady who walked into my office and then said, she was in tears, and then I said, what happened? I said, yeah, my son is coming here for treatment, doctor. You referred me to yoga therapy. You referred him to yoga therapy about a year ago. The last 3-4 months, I am seeing such a good change I've been coming here for a little more than 10 months and you have given my son back to me. This is the word she used. I wondered, what is this, given your son back to me, I asked her. No, doctor, he was an engineer, he had schizophrenia about 8 years ago, stopped going to work, and last 3-4 years he's simply been staying at home. I'm coming here for treatment for last 5-6 years. He's getting antipsychotic drugs. Yes, that shouting, screaming and all those things are there. He's quiet, he just be at home, just watches some TV, reads some books. He's totally unattached. 3 years ago I lost my husband as well. And I've been seeing, once he started coming to yoga, there have been some changes. He has now got a job, he started going to job. She was narrating, then I said, you said you gave my son back to me. Can you elaborate that a little better? She said, 3 weeks back I had my birthday. He said he wished me. It is after 7 years and he is wishing me for the first time. It is not just wishing me the birthday. He brought a sari to me. He brought a sari, the color that I am favorite about. Why would he remember? By bringing a sari is a different thing. He brought the same orange color which was my favorite color. And even more, he brought the same sweet from K.C. Das Rasgulla or whatever it is. K.C. Das Rasgulla, I'm saying, sir, apologies. I'm not mentioning your this thing. But he brought the sweets which I liked from the same shop, which my husband brought 3-4 years ago regularly on my birthday. And he did that. And he says, come, we will go to the temple today and come back, it is your birthday. So this whole process of changing this person is what I really liked, and I wanted to make a mention that you have given my son back to me. This is what is the benefits of improvement in social cognition. And this is what yoga had produced in him. Just a case illustration I thought I should share with you. So our work on yoga in outpatient schizophrenia replicated in 2 different studies published earlier in Acta Psychiatrica Scandinavica and one more recently in Indian Journal of Psychiatry. Both have actually influenced one of the treatment guidelines published by the British NHS, what is called as the National Institute of Clinical Excellence. Nice guidelines. They keep adding some of the guidelines for treatment of psychosis here. In the 2014, they added yoga as a part of treatment to be recommended for outpatient schizophrenia along with medicines which they are receiving. So this was the influence that we were able to succeed in producing in clinical practice. How does it work? And what is wrong in schizophrenia people and which it is expected to correct? And there are 3 elements which we looked at. One of them is mirror neurons, mirror neuron functioning. Second component is oxytocin, there's a hormone which has been talked about in schizophrenia. And third one is this connectedness, brain connectedness. So connecting me to the cosmic consciousness, me with neighbor people, me within myself, the mind and body, me within my autonomic nervous system, and me within the brain, some networks would they get better? Is the question that we examined, and we have evidence at all levels. I thought I will tell you. Mirror neurons is one thing which has been talked about recently. I am not going into the mirror neuron story in detail. However, suffice to say, mirror neuron functioning was lower in people with who had schizophrenia. You treat them even with medicines, not talking of yoga. Even with medicines, mirror neuron functioning starts getting better. So mirror neuron is lower compared to control subjects. So mirror neuron functioning actually improves over course of time. There are 2 different types of mirror neuron tests that they have done. In both the phenomenon, the improvement starts occurring here compared to this, and with treatment it starts inching towards what was there with the normal individual. So this is one published by one author in a journal recently. Mirror neuron functioning and social cognition tests, mirror neuron functioning physiologically, they are highly correlated. Again, social cognition will get better if I somehow activate the mirror neurons. mirror neurons, more activity of mirror neurons, the less of negative symptoms. This was done by some other author using positron emission tomography. There is a negative relationship with negative symptoms and the mirror neuron. More mirror neurons, lesser of the negative symptoms these people have. So there are a couple of tests people have standardized. More and more tests are coming up. For example, you have a static image and a motion observation image. Following yoga, the amplitude of the motion observation image, there is a stimulus given and then you record, the amplitude is becoming more. It means that the person has gotten himself more activated. And in healthy subjects, we were able to demonstrate that static to this thing got improved compared to pre-yoga and then to post-yoga. The difference again was quite significant. So yoga improves mirror neuron functioning. I don't know how to do this.
Do we want, sir?
No, this is supposed to, it always fails me. There is there it is. You make the person look at an image where there is some action which is meaningful compared to a situation where there is no meaning. So the mirror neurons are activated in the first compared to the second. So non-meaningful stimulus versus a meaningful stimulus. This is the paradigm that people use to actually look at the mirror neuron activity in the brain. I must confess, I'm not an authority on the mirror neuron research, but all I have used here is that when this is done, active and a nonsense stimulus, when you look at that, this activation will happen. This activation was not detected before yoga, but it is detected but not as good. But this is highly well detected on the left side of the brain, since you are seeing the right side being moved, or he is a right-handed individual. So the yoga produced this change in healthy subjects, and we also found that this happened in people with schizophrenia individuals as well. This is an example of one individual of schizophrenia, and we have looked at this data in a larger numbers of subjects. In more people, activation was demonstrable if yoga was given than in the numbers of people who were actually waitlisted. Unfortunately, that slide got missed out here. I have straight away gone to the oxytocin story. So mirror neuron activation happens with yoga, and I believe that's what transfers that me to we, which can happen in this phenomenon.
Sir, I have a question. That act of moving that cup, so that activation is happening merely by seeing that, is it? Oh. This one and
Merely
that.
by
See.
Yeah, but I don't
See-
really understand what you mean by meaningful, because there could be just, you can just look at it as two independent things, no? A cup lying on the table and just somebody moving his hand.
Yeah, when the cup is there, then this is a meaningful thing. This has no meaning. This is what is the interpretation, psychological interpretation, and people have demonstrated that there is an activation.
So you're
this
saying,
is,
yeah, okay.
there are better tests people have developed now between the time which we did and this. There is a story of a fire going on, and the person trying to open the door. Child is inside. The mother is trying to open the door, and she can't hold because it's hot, or at least. So this piece of about 6 or 7 seconds is watched. Vis-a-vis nothing at all. She goes and opens. In an emotionally charged situation, you are able to see the mirror neuron activity even better. Of course, there is an improvement going on and on in developing a physiological measure with an appropriate stimulus paradigm. I'm not saying that this
When
is.
she was not able to open because it was hot, it's more.
It's she's feeling.
He's feeling.
Oxytocin is supposed to facilitate mirror neuron function. Oxytocin levels are lower in schizophrenia. People have demonstrated it to be lower also in another relative spectrum disorder called as autism. So low levels of oxytocin in patients compared to healthy subjects has been replicated by 2 or 3 authors, not only in schizophrenia but in a relative condition also called as autism. And so people are treating schizophrenia patients with a nasal spray of oxytocin. Although it is not totally approved, the trials are indicative that nasal spray of oxytocin improves negative symptoms of schizophrenia. And what does, the relationship between social cognition and oxytocin has also more oxytocin, more social cognition. This again, some authors have demonstrated not in schizophrenia individuals, in healthy comparison subjects. What did yoga do? We measured oxytocin in individuals who received yoga, were randomized into getting yoga or waitlisted. In waitlisted individual, oxytocin levels did not change. The oxytocin levels changed by a fraction of almost 3-folds in people who received yoga, pre and post yoga. These are the schizophrenia subjects in whom we also measured social cognition, which got better. Did we get a correlation between this oxytocin level increase and social cognition? We did not get. Maybe whatever the reason. But the fact remains, yoga produces an autogenous elevation of oxytocin. What you would have done with a nasal spray, yoga has been able to do.
I'm wondering how difficult it would be to, about the feasibility of conducting this kind of studies, because an abnormality as rare as schizophrenia, and then being able to pick a subset which is willing to, a set of people who are willing to involve in this kind of intervention. So about all these 27 people, in all 27, were they geographically at the same position?
They are all coming to the hospital in NIMHANS.
Outpatients.
No, we don't do all 15 yoga practice. In other words, it is not that one group of schizophrenia people who are brought and made to do yoga. That was not the way.
That was not the way. But so, and in terms of time and geographical location, they need not be co-located. So, I mean,
geographically means they all did the yoga in NIMHANS.
Acha, I see.
Of course, we taught them yoga at NIMHANS. Some of them would have gone on to practice at home because all 3 months they were not doing here.
And
When they learn yoga in a period of about 1 to 2 weeks, depending on how well they learn, we are allowing them to go back and practice, bring back their log book and see whether they have been
what was the
practicing.
duration of the study?
3 months.
3 months per person, but it's not the same 3 months for all these 15, right?
No,
It would be
definitely.
definitely not.
I think she is pointing out a very good observation. Oxytocin levels are subject to several influences. One of them is gender. Women can have more fluctuations than in men. In both the groups, men-women ratio was not different. Since we were measuring the individuals before and after, the blood sampling was done at the same time. And in women, we made sure that they were in the mid-cycle of menstruation. They were menstruating.
I didn't get that.
Not at the time of menstruation,
Okay.
nor towards the end, in the mid-cycle of the
I
menstruation.
see.
So we don't know whether these are all the variables because oxytocin is particularly woman sensitive, because when the mother is actually feeding the baby, that feeling of oneness actually increases oxytocin in the mother. Oxytocin helps several things in addition to making sure that the womb constricts and the milk is expressed. So there are several other behaviors, effects of oxytocin as well. But as far as schizophrenia is concerned, oxytocin levels have been low. People have shown that oxytocin spray increases social cognition, and we also found that oxytocin levels increased following yoga in schizophrenia individuals. This is another infants, when you are nebulized with oxytocin, when you are suspecting autism spectrum disorder, they don't fix the gaze on the other people. Those of you who might have seen an autistic child would know that the autistic child never fixes the gaze. Eye contact is limited. You give, and they don't make gesture imitation. You wave, they don't wave. You say namaste, they don't. So these are all gesture imitations are minimum, because all these gesture imitations are related to mirror neuron activity and in turn oxytocin. Oxytocin nebulization increased gesture imitation. in children, and even in children who have autism, children and adolescent autism. One author has examined people who had this autistic disorder, measured on various things, and yoga practice actually facilitated both oxytocin levels and their clinical behavior as. And they are also supposed to have measured some of the MNEA functions. I don't have the data here. Oxytocin levels elevating with yoga has been demonstrated not only in schizophrenia, to some extent also in autistic children. So this is the only study in children conducting any blood sampling that more so when they are disabled has a lot of ethical issues, and I think should be congratulated, this person who made this. This is the last two slides about schizophrenia. I was talking about network within the brain. We have what is called as the default mode network. Healthy controls and schizophrenia. If you can see here, yellow means a little more active. Compared to my first yoga slide, yellow was deactivated. Ignore that. But here, yellow is more active, red is less active. Default mode network somewhere comes here. If you look at the side, it comes posteriorly in the midsection. The default mode network is lower active in schizophrenia individuals. This has been, there are some, of course, in acute stages, they are more active in schizophrenia compared to healthy subjects. In chronic individuals, it is less active. Since our studies have been largely on chronically ill individuals, we are talking of less active. So, default mode network has several implications. If it is more active, the person is focusing, looking inwards, looking into himself. If it is less active, the brain is let loose, it wanders. Yoga chitta vritti nirodha. Yoga is supposed to reduce that wandering. And so we looked at what happens to the default mode network in schizophrenia individuals before yoga and what happens after yoga. Over the course of, as you can see, it got brighter as the yoga practices went on. And in these individuals, they also had this of course, what we are measuring is activation. One of the measures is the coherence. Again, the statistics of this, I have my limitation to understand, but our image processing analysis say that the coherence increases following yoga, which means the activation is better. This is the default mode network, which shows that the default mode network, as coherence gets better, these negative symptoms, they also become better. This is the improvement in the negative symptoms shown on the y-axis, default mode network coherence shown on the x-axis. This relationship, of course, does not happen to the positive symptoms, indicating that default mode network perhaps was related to the person getting normalized with respect to losing the negative symptoms. So, in effect, yoga improved mirror neuron function in schizophrenia, increased oxytocin levels in schizophrenia, and also led to improved connectivity as a measure reflected in coherence in the default mode network in these schizophrenia subjects. So this, why does yoga produce this? Yoga is taught by an influential yoga teacher. They all follow, imitate his movements, and then they go on. This is one of the hypotheses that have constructed. It to be tested whether yoga would get better even if the person is not watching the yoga teacher, following only the instructions and then doing. They're all experimentally doable, but I don't think I'm going to invest time on all those things. But this is one of the reasons. We also have proof that yoga improves Gaba in schizophrenia subjects, although I have not put it into the link with the whole thing. So yoga improves symptoms, social cognition, and that connectedness feeling. I am forced to give a small anecdote about this connectedness. A adolescent girl daughter of my classmate, studying IT. I had been to their house. I saw the walls full of yoga teachers, yoga postures, and so on and so forth. I knew my friend wouldn't have any knowledge or any inclination for yoga, as worldly as I am. So I asked him, where did all these things come? When did you get attracted to yoga? He said, I am not doing any of those things. It is my daughter who is doing it. It actually surprised me even more. An adolescent girl ought to be doing all these things. I really wondered if it was so. I said, can I talk to her? She was doing some record, I don't know, whatever she was. She came out. I asked her, is this, yes, uncle, I am doing all these things. How did you get attracted to yoga? Yeah, yoga is very good. Good means what? What happens to you when you do yoga? I feel connected. And when she said that, my experiment started about research on connectedness after this world of connectedness, and I looked up amongst the top 5 experiences of yoga people recount. One of them is feeling connected. Connected with what? Connected with my teacher, connected with my classmates who are doing with yoga, connected with people around in my family, connected with my people around the world. In the city, I feel all of them are with me. I don't feel alone. I feel confident. I don't feel isolated. You know, when this happens, the world becomes one, and the world becomes Vasudhaiva Kutumbakam. A lady, 18 years old, it was not Baba Ramdev, it was not Sri Sri Ravi Shankar, it was not Sadhguru. A lady, 18 years, can get this feeling and able to generalize it into a philosophical, spiritual sense, made me very impressed on that day. Then I came back, looked at all the literature about connectedness and story. And although I formulated all my theory, I was already doing some work on schizophrenia, but my interest into look at the connectedness story happened after this experience this lady recounted. And so I stop here. We have a big team of yoga department. Now we call it as integrative health department. For the first time, the government allowed it to be established in an allopathic hospital. Till now, of course, the Ayush hospitals had yoga departments. Allopathic hospital, for the first time, formal establishment of yoga department as the integrative health department has happened in NIMHANS. Thanks to all my colleagues who worked with me. And I thank each one of you for being with me, and I also thank Goddess Saraswati for enriching my knowledge and let me present things with you. Thank you so much.